Hi, my name is Nia, and today I'm going to be demonstrating IV venipuncture. One of the first steps I'm going to do is I'm going to be verifying the provider's order. I'm going to check over the provider's order and I'm going to look into the patient's history and I'm going to identify any bleeding disorders that the patient may have. After I do that, I'm going to gather my supplies. So with me, I have a tourniquet, IV extension tubing, I have an IV 22 gauge IV needle, saline flush, some Tegaderm and tape, and alcohol prep pad. So after I gather all of my supplies, I'm going to head to the patient's room. When I enter the patient's room, I'm going to introduce myself to the patient and the family, and I'm going to provide some privacy. After doing that, I like to tell the patient why I'm there. And based for this demonstration video, I will tell the patient that I'm there to insert an IV. After I do that, I'm going to perform some hand hygiene and I'm going to apply my gloves. After I apply gloves, I want to make sure that I identify the patient with at least 2 qualifying identifiers, which would be their first and last name and their date of birth. After doing that, what I'm going to do is I'm going to see if the patient has any allergies, and I'm also going to obtain some baseline vitals, I'm sorry. So when I do that, what I'm going to do is I'm going to tell the patient why I'm there. So I'm telling them I'm going to be starting an IV. I'm going to be telling the patient where I'm going to be inserting the IV, and I'm also going to tell the patient the purpose of that IV. So after I do that, I'm just going to make sure that the patient understands what I'm going to be doing, and I'm going to allow any time for questions that the patient may have. After doing that, what I'm going to do is I'm going to apply the tourniquet onto the patient's arm. But before that, I just want to make sure that I assess the patient's arm for any signs of it being compromised, because I want to ensure that I'm inserting the IV safely. So now I'm going to apply the tourniquet. Okay, so now after applying the tourniquet, what I'm going to do is I'm just going to assess the site. And while I'm assessing the site, this is when I'm going to choose where I want to insert the IV. After finding where I want to insert the IV, I'm going to check for the distal pulse. When I find that pulse, I'll make sure that I'm going to cleanse the site that I want to put the IV. So I'm going to get an alcohol prep pad, and I'm going to go in a horizontal and vertical pattern. And I'm going to go from an inward to outward pattern in a circular motion. And you want to do this for about 30 seconds. So after I'm done with that, I'm going to allow this to dry. After the site dries, now what I want to do is I'm going to anchor the vein at least 1.5 to 2 inches below the site. And I just want to advise the patient not to make any sudden movements. So while I'm doing that, what I'm going to do is I'm going to make sure I get my needle ready. And you want to insert the needle bevel up from a 10 to 30 degree angle. When you go to that 10 to 30 degree angle and you insert that needle, you want to see some blood flashback. When you see the blood flashback, you're going to advance the needle about 1/4 of an inch into the vein. When you do that, you're going to slide the cannula onto the skin, and you want to make sure that the cannula is flush with the skin before taking the needle out. So when you take that needle out, you're going to apply some pressure to that spot But you also are going to recap that needle for safety purposes. When the needle is recapped, you want to release the tourniquet. Now that the tourniquet is now that I release the tourniquet, what I want to do now is I want to prime this flush. So you're going to prime that flush. You want to make sure that that air bubble gets out of there, because you don't want that air going into the patient's vein. So I'm doing that. Now that I've done that, I'm going to insert it onto I'm going to insert the extension tubing onto the cannula. And now you're going to screw on that flush onto the other end of the extension tubing, making sure that you want to keep a firm to gentle pressure on that site, just to make sure that you're stabilizing the cannula. And you're just going to flush the site, flush that tubing, I'm sorry. You want to slowly flush it, about 3 cc's of sterile saline. Now that you've done that, I'm going to get my Tegaderm, and I'm going to place that over the site. You're just going to take that tape off of there. And I'm going to remove, and I'm going to recap the other end of the extension tubing. While I do that, now it's time to get my tape that I already have prepared. And you're going to put that at the bottom, just to make sure that you're securing that site. And you're going to loop it around, and you're going to secure that as well with some tape. Now, after you've done that, what you want to do is that you want to make sure that you label. So you're going to label date, time, the gauge, and the length on top of the clear dressing. Make sure you do that before leaving the patient's room. Also, after you insert this, you always want to make sure that you're checking to see if the patient's comfortable. You want to see if that call light is next to the patient. Also, you want to check that their personal items are in reach. You want to raise those side rails up. And also, what I'm going to do is I'm going to make sure that the bed is at its lowest position, to make sure that the patient doesn't fall, and just to make sure that that patient is safe. When you do that, I'm just going to expose of all the trash that I have, including the needle. I'm going to put the needle in the sharps container. And I'm going to remove my glove, do some hand hygiene. And before I leave the patient's room, I'm going to make sure that I document what I've done in the room before leaving. And that is my IV insertion.